Hi, I'm Nina Shah. I'm from the University of California, San Francisco, and I'm here at the 2019 annual ASH meeting. We are very excited because there's a lot going on with chimeric antigen receptor T-cell therapy, or CAR T-cell therapy, and we're going to hear more about that at this year's meeting. This year, we're going to be getting a little bit longer follow-up from the LEGEND-2 data, which was originally conducted in China and previously had shown a median PFS of 15 months and 24 months for MRD negative patients. So that's going to be updated for those 57 patients, and we think that's probably going to hold up as far as PFS, and actually looks like it's going to be improved based on the abstract that was published already. In addition, the American counterpart of that trial, which is the CARTITUDE trial, now being run by Janssen, is showing preliminary data as well, and they're showing an overall response rate of 91%, which is really phenomenal, and one of the things that we were interested in seeing if this was going to be recapitulated in the American population, given that this trial was originally run in China. Even more interesting, there's going to be some translational data presented from that study showing how the apheresis product and more importantly, the in vivo expansion phenotype changes as patients undergo this therapy, and suggests maybe that some of these cells are T-naive or stem cell memory-like, which would be important in understanding efficacy, and not just efficacy, but persistence. There's going to also be some updates from the BB21217 data. This was originally presented last year. This is also a BCMA specific CAR T-cell and uses the same construct as BB2121, but is cultured in the presence of a PI3 kinase inhibitor to theoretically improve the stem cell memory-like phenotype cells in the product. This data, as I mentioned, was originally presented last year with 15 patients, but now at least 22 patients will be presented as far as follow-up, not only so that we understand safety at higher doses, but also some preliminary efficacy data. We're interested to know if there will be any other correlative data, and that remains to be seen based on the presentation that's pending. So we're excited about those two as well. In addition, we're going to be hearing some interesting data on using a gamma secretase inhibitor, or GSI, to improve or increase the amount of BCMA that's expressed on the myeloma cell surface. And there will be preliminary results of a clinical trial from the Fred Hutch looking at treating these patients with BCMA-specific CAR T-cells in the presence of a GSI and seeing if there's any improved efficacy there. We're really excited about other types of CAR T-cells being developed, some of which were presented last year and don't have updates necessarily this year. But one of the things that we are noticing is that there's an uptick in the number of CAR T-cell trials and longer follow-up, which I think is really important. Some of the interesting ways that people are trying to improve on CAR T-cells include targeting multiple antigens, whether it's targeting CD19 and BCMA, or maybe other therapies that target CD38 and BCMA. One thing I did want to mention that's not a CAR T-cell, but it is a bispecific T-cell engager, also known as a BiTE, but in this case this is made by Celgene, and they're going to have their preliminary data for the first time shown. This molecule is given not as a continuous infusion, but rather initially weekly, then every other week, and eventually every 4 weeks. So that actually is very patient-friendly. Their abstract, as published so far, shows an 83% response rate in their active doses, so in the second dose that they're demonstrating, and relatively usual safety numbers with as far as CRS, which is actually pretty well managed with either dexamethasone or tocilizumab. I'm interested to see further data from this because I think it's going to inform us of a potentially outpatient-friendly, off-the-shelf BCMA therapy, and I think that's something that we will need because not everybody will be able to get CAR T. So in short, I think there's a lot of exciting data specifically around immunotherapy, BCMA-based therapy, CAR therapy, and bispecific therapy, and I'm looking forward to a great meeting.